Welcome to the Western Wisconsin Journal Health segment on the River Channel. I'm Lori Poppy, registered nurse at Hudson Hospital Specialty Clinics. Today my guest is Dr. Emily Hall, internist from Hudson Hospital Internal Medicine. Dr. Hall is joining us today to talk about staying healthy tips when traveling on spring break or any time of the year. Welcome, Dr. Hall.
Thank you. It's great to be here. Like you said, I do have some tips for helping people stay healthy while they're traveling, and I think this is a good time of year to share those tips. I know I just returned from a trip with my family to Florida, and I know some people are still thinking about heading south to escape to a warmer climate for a few days, or maybe go out west and go skiing. And so I do have some recommendations that I think can help people stay healthier.
Super. I agree. But first, for our viewers, I'd like to share Dr. Hall's background. Dr. Hall is board certified with the American Board of Internal Medicine and completed her medical school at Mayo Clinic College of Medicine in Rochester, Minnesota. She completed a residency in internal medicine at Abbott Northwestern Hospital and internship at Hennepin County Medical Center. Dr. Hall is now with our internal medicine clinic located on the second floor of Hudson Hospital campus. So we're really happy to have you.
Thank
But
you.
maybe you could let the viewers know a little bit more about it. What is internal medicine?
Absolutely. So internists are specially trained to diagnose, treat, and prevent adult illnesses. So we function as primary care providers for adults, but we can also serve in a consultative position. We're sometimes called the doctor's doctor because other doctors will refer patients to us when they have a specific question, including something like a pre- or post-travel consultation.
So Dr. Hall, if I were planning a vacation, what's the first thing I should do when it comes to my health?
Great question. The very first thing you should think about is whether your vaccines are up to date, because you're more likely to be exposed to one of those preventable illnesses while you're on vacation, even on the airplane. So I recommend that everybody make sure that they had their yearly flu shot before they go. Even if they think they're at the tail end of the flu season, they might end up with an exposure they weren't expecting, so it's worthwhile getting that. And then the other most important vaccine to have up to date is your tetanus. And now the tetanus comes along with the pertussis. Pertussis is whooping cough, and we're finding that adults, even if they were vaccinated as kids or had the illness as kids, the immunity wanes over time. And so the disease presents differently in adults. It tends to be a cough that lasts longer than 3 weeks. So you don't have that typical whooping cough sound. At the same time, you get a persistent cough. And if you're somebody with chronic lung disease or heart disease, that can be a real problem. So be sure you're up to date on your tetanus shot, which includes the pertussis. And then just all of the typical vaccines, the measles, mumps, and rubella, the polio. And then if you're going someplace like Mexico, your doctor is likely to recommend hepatitis B and typhoid vaccines as well.
Well, if I'm unsure of my vaccination history, what should I do?
So many clinics now have online patient services. I know that Health Partners does, and so that's been really helpful with my kids. We go right online and get their immunization records for ourselves and print them out, which is great to give to schools. If your clinic doesn't have the online services, you can always call and ask the nurse to send you a copy, or just go in and meet with your doctor before you go on a trip and get general recommendations along with your list of vaccines that you've had.
Okay. So anything else? Any other important tips and next steps?
Yeah, so the next thing I'd recommend is, one of the most common illnesses that can really ruin an otherwise great trip to a warm climate is traveler's diarrhea. And there are ways that you can avoid contracting that. The best ways are to make safe food and drink choices. So you want to be sure that all of your drinks are bottled and that they come in a sealed bottle, the water especially. And then, other drinks are okay, including hot tea or hot coffee. The coffee and tea don't have to be to the boiling point, but just so that they're warm when you drink them or hot. And then foods, you want to be sure you have foods that have been fully cooked and are served warm. So some of the foods that are most fun when you're on vacation are things like guacamole, pico de gallo, the blended margarita. All of those things you probably want to wait and have them when you come home so you can remember your vacation and remember the place that you were. And then if you want to have fruit, be sure to get a fruit that you can peel yourself. And those are good ways to help prevent contracting the illness. But even if you're very, very careful, it can still happen. And so often a doctor will prescribe an antibiotic for you to take along with you, and you can take that in case you contract the diarrhea.
So what's the most common used antibiotic for this? Mm-hmm. And is there anything over in the counter that maybe you should consider?
Right. So ciprofloxacin is the most common antibiotic that's prescribed. You take that 2 times a day for anywhere from 1 to 3 days. But if you have an allergy to that class of antibiotics, there are others that can be equally as effective. Some over-the-counter medications, things like Lomotil or Imodium, are effective, but it is recommended that you don't take those unless you're also taking the antibiotic, because there are some infections that will be prolonged if you take the anti-motility agents, because your body's not able to clear the bacteria as quickly.
How about your medications? So how can I safely take them with me?
So it's the best idea to carry them on instead of putting them in your checked luggage. And bring them in their original bottles, so they have the prescription right on there. If you have any liquid medications, the Security Administration may have to do some extra testing on it while you're going through the security line. But the pills and things should be just fine to go right through. And then it's a great idea to bring an updated list of your medications with you in case you lose one or there's any question about a refill or something like that.
Okay. I do know that just recently at the clinic we had some patients that were taking double prescriptions with them. They had a written prescription along with their medication.
That's a great idea. Great idea. Yeah. And most clinics now and pharmacies will give you a 90-day supply of your medications. So if you're going to be gone for a prolonged period of time, you might want to just get all of them filled right now and bring them with you.
Good idea. Okay, so covering that, if I'm planning a trip south, what specific health concerns should I be concerned about?
Yeah, so mostly it's about the change in climate. So, we've all sort of grown accustomed, even though we may not be enjoying it very much, our bodies have grown accustomed to the cold weather that we've been through this winter. And so when you shock your system by going to a warm climate, all of a sudden, it can be a little bit more difficult than you expected. So try to stay out of the sun and out of the heat during the most intense hours of the day. So, anywhere from around 10 a.m. to 2 p.m. or so, or 3 p.m., depending on where you are. And you can definitely be outside, but try to be in the shade, a nice breeze wherever you are. And then wear some protective clothing to protect you from the sun. And, sunscreen is a great idea.
And what SPF should you be wearing, taken along with you?
Yeah, I tend to recommend 30. I think numbers lower than 30 don't offer the full protection. Numbers higher than 30, I'm not sure that they make much of a difference above the 30. So anything that says 30 or says above 30 is a good idea. And then you do need to remember to reapply. If you get wet, even if the sunscreen says that it's waterproof, none of them are 100% waterproof. Or if you don't get wet, but if you're out there for more than a couple of hours, you probably need to reapply the sunscreen to make sure it's effective.
Okay. Well, I've heard of a lot of people taking trips out west to go skiing and snowboarding.
Right.
What's our big concerns for that?
Right. A couple of things. One is the change in altitude. And if you've got a chronic heart disease or chronic lung disease, you should check with your doctor before you go about any kind of precautions you should take. They may alter some of the doses of your medications while you're there, or recommend you take your inhaler more frequently. And then the other concern is if you're going on a ski vacation, there's the chance for injury. So be sure you're wearing your protective equipment, like a helmet, and then stretch out before you get out there the first time, and maybe start with the easier hills until you're used to it and you're really warmed up.
Good points. Do you have any suggestions for the elderly people that travel south, the snowbirds that go for more than just a few weeks?
Right. I think many people would benefit from having another primary care doctor if they're traveling most years or for several months of the year. And you can do that a couple of different ways. You can find somebody. One way is to check with your insurance company to see which clinics near you where you're going to be staying would accept your insurance and have the best coverage. You could also check with your primary care doctor. Sometimes they know of a clinic or know of a person who they'd recommend in another state. So that can be helpful. If you don't want to go that far, at least identify a place you can go if you have urgent needs. And then definitely bring a list of your medications with you, as I talked about, a very specific list with dosage and the generic names of the medications. And if you can get from your doctor before you go a summary of your recent health history, that's extremely helpful because many of us are on the electronic health record right now. Mm-hmm. We're able to look at that from one clinic to the next, but it's not always transferable from state to state. And so if you have that recent summary, then no matter what happens, if you're not able to give a history because you're hurting or something else is going on, then they've got that, and that really, really helps out the ER physician or whoever else is taking care of you.
It's another good reason to sign up for online patient services. I bet most EMRs have that available to their patients. So regardless of where you belong, you could probably have that information as close as a fingertip.
Right.
Good. How about, is there any concerns about taking your children? Things we should be concerned about.
Right. Well, I just went on a trip to Florida with my family, and I have 3 young kids, and my main concerns were, their physical health. So I have a 2-year-old, and just as soon as we got to the place where we were staying, I had to do a quick survey of the place and make sure that there were no cords that she was going to pull on or lamps that were going to fall on her or something heavy up high that she'd try to grab. So that's one concern. And then ingestion is the other with really small children. Because you may not be aware that, the cleaning supplies are stashed down at floor level, whereas at home you probably keep them up high. Right. And then being near water, if your kids are not used to that, or even if they are used to it, definitely they need supervision.
Mm-hmm. Any health concerns if I'm planning a trip overseas, Europe?
Sure, there are specific health concerns no matter where you go, and I would recommend that anybody who's going to go on a trip, if you're going on a mission trip or going to visit family in another country, in a place that you're not very familiar with, the CDC website is a really good resource, and it's www.cdc.gov. There is a place on the website where you can type in the location that you'll be traveling to and then fill in specific information about whether you'll be staying with family, whether you'll be in a city or in a rural area. And then it tells you which vaccines you should get, if you need anti-malaria prophylaxis, and what sort of specific concerns to be aware of before you go.
Great information. What was the website again?
cdc.gov.
Super. So these are all great tips. Is there anything else you want to discuss?
Yes. One other topic I wanted to be sure to touch on today is the risk of motor vehicle crash. Now, many people don't realize or just don't think about it before they go, but that is the most common cause of death for healthy Americans traveling internationally. And so when you make your plans for getting to where you're going, also ahead of time, make your plans for how you're going to get around once you get there. And public transportation is safer than private rental cars. So try to choose the public transportation as much as you can. And then the other dangers are things like motor scooters, motorcycles. If you're going to try that while you're there, go slowly, know your limits, wear a helmet, and then also be aware that in other countries and even in other states, there are different laws about who has the right of way, whether it's the pedestrian or the driver. And so if you're the pedestrian, just be sure that you're watching out for yourself and not just walking out into the street.
But most importantly, Have a nice time, enjoy, relax,
Exactly.
enjoy the sunshine, right?
Yes, right.
And safety should be top of mind. So, Dr. Hall, let's just recap. Could you remind our viewers the resources that are available to them?
Absolutely. So you've got your physician, your pharmacist, online patient services. Also, I didn't mention this before, but there's also virtuewell.com, which could be really helpful if you're in another state and you need acute care for yourself or one of your children.
So I do know up at the clinic we occasionally have people schedule visits deliberately for pre-travel. Do you think that's a good idea?
I think it's a great idea. And to recap, my top 5 healthy travel tips. Be sure your vaccinations are up to date. Bring a list of your medications and refills with you. Learn where medical care is located nearby your vacation destination. Remember safe transportation. Bring sunscreen. In addition to what's listed here, also remember to make safe food and drink choices to avoid traveler's diarrhea. But of course, most importantly, relax and enjoy.
Thank you, Dr. Hall, for joining us today and sharing these insightful tips on healthy travels.
Thank you, Lori. It's been my pleasure.
We would like to thank the River Channel and Western Wisconsin Journal for offering this health segment to the communities we serve. Thank you.